Have you ever taken magnesium because you heard it helps with sleep, stress, or even wrinkles, but ended up feeling worse instead of better? You're not alone. Many people take magnesium supplements daily, believing they're safe for everyone. But here's the truth. In certain situations, magnesium can do more harm than good. Hello, my friends. I'm Dr. Masayuki, and welcome to Life in Harmony, where we explore science-based ways to stay youthful, strong, and full of life. Magnesium supports over 300 vital reactions in your body, from your heartbeat to your energy, even your collagen and antioxidant defenses. Yet nearly 80% of adults don't get enough. Still, taking it the wrong way, or when your body can't handle it, can lead to kidney, heart, or breathing problems. Magnesium can do amazing things for your body, relaxing your muscles, calming your nerves, and restoring balance. But when taken incorrectly, it can also cause serious harm. After reviewing countless medical studies and real patient cases, I've seen how easily people make preventable mistakes. Some take magnesium when their body doesn't need it. Others combine it with medications that create dangerous interactions. The result? Kidney strain, irregular heartbeat, even breathing difficulties. So today, I'll guide you through everything you need to know: who should take magnesium, who shouldn't, the right dose, and how to use it safely. Stay with me until the end, because these insights could literally protect your heart. And if you find this helpful, subscribe and join our Life in Harmony family, where we age smarter, together. 4 warning signs you should never take magnesium. Let's start with the most serious warning sign: kidney problems. Your kidneys are your body's natural filter. They clear waste, balance minerals, and make sure nutrients like magnesium stay in just the right range. But when your kidneys aren't working well, they can't remove excess magnesium efficiently. The mineral builds up quietly in your blood, until one day, it becomes toxic. This condition is called hypermagnesemia, and it can be dangerous. At first, you might just feel a little off, maybe some nausea, diarrhea, or fatigue. But if levels continue to rise, symptoms can progress to muscle weakness, dangerously low blood pressure, slowed breathing, or even cardiac arrest. I'll never forget Dorothy, a patient of mine, a warm woman, 72 years old, with mild kidney disease. She'd read online that magnesium could ease her constipation, and decided to give it a try. What she didn't know was that her kidneys couldn't filter magnesium efficiently. Within just 5 days, she began feeling nauseous, weak, and dizzy, symptoms she brushed off as a mild flu. When her husband brought her to the clinic, we discovered her magnesium levels were dangerously high. Dorothy spent several days in the hospital recovering. If your kidneys aren't working perfectly, never take magnesium without your doctor's approval. Now, let's talk about another red flag: very low blood pressure, or what doctors call hypotension. Magnesium is a natural relaxer. It calms your nerves and smooths your blood vessels. That's one reason it helps reduce stress and tension. But if your blood pressure is already on the lower side, that same relaxation can push things too far. Your vessels widen, your pressure drops even more, and suddenly you feel dizzy or lightheaded when you stand. I remember a man named Frank, 69, who came to me after fainting in his garden. He just wanted to ease his muscle cramps. His blood pressure usually sat around 100/65, already on the low side. After hearing magnesium could help, he started taking it daily. On the 3rd morning, as he stood up from the table, the room began to spin. He barely caught himself on the kitchen counter. When his wife checked his blood pressure, it was down to 85/55. A quick call to his doctor revealed the culprit: magnesium. Once he stopped, his blood pressure returned to normal within 2 days. Next, let's move to the heart, quite literally. Magnesium plays a key role in how your heart's electrical system fires. It helps regulate each beat, like a metronome keeping your heart's rhythm steady. But if you already have a slow heartbeat, known as bradycardia, or certain rhythm problems, like heart block, adding magnesium can slow those signals even more. That means your heart, instead of beating with a calm rhythm, can become too slow, sometimes dangerously so. Consider Robert. He was 75 years old and had a naturally slow heartbeat, around 55 beats per minute. His doctor was keeping an eye on it, but nothing seemed alarming. Then Robert decided to try magnesium to help him sleep better. After a week, he started feeling weaker and more tired on his daily walks. At his next checkup, his pulse had dropped to just 42 beats per minute. The magnesium had slowed his heart even more. His doctor told him to stop immediately, and within days, Robert's heart rate returned to normal. So, if you've ever been told your heart rate is slow, or you're on medications that affect rhythm, like beta blockers, tell your cardiologist before starting magnesium. Your heart thrives on balance. Too much of a good thing can silence its rhythm, instead of strengthening it. Now, here's something many people often overlook: medication interactions. Magnesium may be natural, but it doesn't always play nicely with other drugs. First, let's talk about antibiotics. Certain types, for example, tetracyclines and fluoroquinolones, can't be properly absorbed when taken with magnesium. The mineral binds to the medication, making it far less effective. So, if you're fighting an infection, that harmless supplement might actually block your treatment. Next, muscle relaxants. Both magnesium and these drugs calm the nervous system. Taken together, they can over-relax the body, leading to dangerously low blood pressure or a slow heart rate. And then, there are cardiac glycosides, such as digoxin, used to strengthen the heart. Magnesium can alter how these drugs are absorbed, creating unpredictable and sometimes unstable medication levels. I'll never forget Margaret, an 81-year-old woman whose heart condition had been well managed with digoxin for years. Everything was stable until she added a magnesium supplement to ease her leg cramps. At her next checkup, her blood tests showed something strange. Her digoxin levels were suddenly swinging from too low to too high. It took weeks for her cardiologist to figure out what was happening. The magnesium was interfering with her medication. Once they adjusted the timing of both, her heart rhythm and medication levels finally steadied again. All right, let's turn the page, because now we're talking about the other side of the story, when your body is quietly begging for magnesium. One of the most common signs? Muscle problems. You know that sudden cramp in your calf that jolts you awake in the middle of the night? Or that odd twitch under your eye that just won't quit? Those are your nerves and muscles calling for help. Magnesium is essential for helping your muscles contract and relax smoothly. Without enough of it, your nerves fire too easily, creating cramps, tingling, or stiffness. It's like trying to run a machine without enough oil. Everything starts to seize up. I often tell my patients to imagine this. You're lying in bed, stretching your leg, and suddenly, ouch! That painful knot hits. A magnesium-rich dinner with foods like spinach, almonds, and pumpkin seeds could have made all the difference. This isn't just about comfort, it's also about aging gracefully. Strong, flexible muscles support better posture, steadier movement, and fewer wrinkles from chronic tension. So, if your body is tight, twitchy, or cramping, it might be time to show it a little magnesium love. Now, let's talk about something we all feel: stress. You know that sense of being wound up, even when you're exhausted? Here's the sneaky part. Stress doesn't just make you tense, it actually drains your magnesium stores. When you're anxious or overwhelmed, your body releases stress hormones that tell your kidneys to flush out magnesium through urine. And the less magnesium you have, the more reactive your nervous system becomes. It's what I call the quicksand of stress and magnesium. The more stressed you are, the more magnesium you lose, and the more you lose, the more stressed you feel. It shows up as irritability, anxiety, poor sleep, a restless mind, or that wired but tired feeling late at night. Here's the call-out I tell my patients. If you feel tense but can't relax, magnesium might be missing. Restoring your magnesium levels can calm your nervous system naturally, helping you sleep deeper, worry less, and even reduce fine lines that stress carves into your skin over time. Because true anti-aging isn't just about creams, it's about calming your cells from the inside out. As we get older, our bodies become a little less efficient at absorbing what they need, and magnesium is no exception. With age, the stomach produces less acid. That means the nutrients in your food, especially minerals like magnesium, aren't broken down and absorbed as well as they used to be. Add to that a lower appetite, dentures, or foods that are simply harder to chew, and it's easy to see why many older adults fall short. But here's the twist. Magnesium is one of the minerals that helps your body generate energy, maintain strong bones, and keep muscles and nerves steady. A lack of it can make fatigue, weakness, or even anxiety worse, which many people mistake for just getting old. So, if you're over 60, try building a magnesium-rich plate leafy greens, like kale and spinach, nuts, seeds, and whole grains. And here's my doctor's tip. Choose magnesium glycinate. It's gentle on digestion, easily absorbed, and far less likely to cause stomach upset. Small daily choices like this can bring back calm energy, steadier moods, and even help your skin glow from better nutrient balance. Now, for people on certain medications. If you're taking daily medications, there's a good chance some of them are quietly draining your magnesium reserves. Two common culprits: diuretics, often called water pills, and proton pump inhibitors, PPIs, used for heartburn or acid reflux. Diuretics make your kidneys excrete more fluid, which can also wash away electrolytes like magnesium. Over time, this slow loss can lead to subtle symptoms: fatigue, muscle cramps, irritability, or a strange buzzing in the limbs. PPIs work in the opposite way, by reducing stomach acid. But that acid is essential for unlocking minerals from food. Without it, magnesium simply doesn't absorb well, even if your diet looks perfect. The result? You may feel constantly tired, anxious, or achy, and never suspect your medication is part of the reason. If this sounds familiar, don't rush to the supplement aisle just yet. Instead, talk to your doctor or pharmacist. Ask if your medication could be lowering your magnesium, and whether testing or gentle supplementation is right for you. Sometimes, simply adjusting timing, dosage, or diet is enough to restore your body's natural balance. For people living with diabetes, magnesium isn't just another nutrient, it's a missing piece in the energy and blood sugar puzzle. When blood sugar levels stay high, the kidneys work overtime to flush out the excess glucose, and along with it, they also wash away magnesium. Over time, this constant loss can leave the body depleted. Here's another hidden link. Every time insulin moves sugar into your cells, it can cause a temporary dip in magnesium levels. So, even with normal readings, your reserves might still be running low. Low magnesium doesn't just cause fatigue and cramps. It can make blood sugar control harder, creating a frustrating cycle. The good news? When magnesium levels are restored, insulin sensitivity improves, energy stabilizes, and even sleep tends to get better. However, there's one vital caution. If you have diabetic kidney disease, you should never take magnesium without medical supervision. Impaired kidneys can't clear the excess, raising the risk of toxicity. In short, magnesium can be a powerful ally, but for diabetics, it's a nutrient that demands respect and guidance. Now let's talk about the best magnesium forms and natural sources. For people with diabetes, magnesium plays a surprisingly vital yet often overlooked role in maintaining stable blood sugar and steady energy. When blood sugar runs high, your kidneys try to clear the excess glucose through urine. Unfortunately, they also flush out magnesium in the process. Over time, this constant loss leaves your cells running on low fuel. Adding to the problem, insulin, the hormone that helps move sugar into cells, can cause a temporary drop in blood magnesium each time it acts. That means even well-managed diabetes can silently drain this mineral. The result? You may notice fatigue, muscle cramps, or uneven blood sugar levels that are harder to explain. Restoring magnesium can help improve insulin function, support energy, and even calm the nerves. But here's an important warning. If you have diabetic kidney disease, never take magnesium supplements on your own. Damaged kidneys can't clear excess magnesium, which can lead to serious complications. Always consult your healthcare provider. Magnesium can be your ally, but only with proper supervision. When it comes to magnesium, more isn't better, balance is everything. For most adults, a safe daily intake ranges from 100 to 200 milligrams of elemental magnesium. Going beyond 350 milligrams per day without medical supervision can lead to digestive issues, or even dangerously high magnesium levels, especially in older adults or those with kidney concerns. Choose your form wisely. Magnesium glycinate and magnesium malate are the most gentle and effective options. They're well absorbed, kind to the stomach, and less likely to cause loose stools. On the other hand, magnesium oxide, found in many cheap supplements, has poor absorption, meaning most of it passes right through, often leaving you with uncomfortable diarrhea. Always read labels carefully. Check the actual elemental magnesium amount, not just the compound weight, and buy from trusted brands that test for purity and quality. Your body deserves calm, not chaos, from supplementation done right. Rules for safe use. Even with all its benefits, magnesium must be taken with awareness. Here are 5 essential safety rules to keep your body in harmony. 1. Balance with vitamin D. If you're taking high doses of vitamin D, over 4,000 international units daily, remember, it can drain magnesium stores, since your body uses magnesium to process vitamin D. Without enough magnesium, even the best vitamin D supplement won't work efficiently. 2. Don't rely solely on blood tests. Most magnesium lives inside your cells, not in your bloodstream. A normal lab result doesn't always mean you're truly sufficient. 3. Keep a healthy calcium to magnesium ratio. Aim for about 2 to 1. Too much calcium without magnesium can lead to kidney stones or artery calcification. 4. Limit caffeine and alcohol. Both cause your kidneys to excrete magnesium faster, leaving you depleted. 5. Avoid taking magnesium on an empty stomach. Always take it with meals to improve absorption and prevent cramps or diarrhea. Transition. Now that you know the rules, let's see how to begin safely. Step by step. How to start supplementing safely. Starting magnesium doesn't need to be complicated. It just needs to be gentle and consistent. Begin with 100 milligrams per day, preferably taken with dinner. This allows your body to adjust and helps you gauge tolerance. If you feel comfortable after a few days, gradually increase to 200 milligrams per day, dividing the dose between morning and evening to maintain steady levels throughout the day. Always take magnesium with food, especially meals that contain healthy fats like avocado, olive oil, or nuts. Fat enhances absorption, helping more of the mineral reach your cells where it's needed most. Avoid taking magnesium alongside high-fiber meals or drinks such as bran, cereal, or green smoothies. Fiber can bind minerals and reduce their uptake. And remember, supplements are just that, supplemental. They're meant to support a balanced lifestyle, not replace real nourishment from whole foods like leafy greens, seeds, and whole grains. With patience and awareness, magnesium can become a simple, steady ally for calmer muscles, a steadier mind, and deeper rest. We've explored the 4 warning signs when you should never take magnesium, and the 5 signs that reveal your body urgently needs it. The lesson is simple. Balance is everything. The right dose, the right timing, and the right medical guidance make all the difference. If today's video helped you understand magnesium better, give it a thumbs up, share it with someone who uses supplements, and subscribe to Life in Harmony for more science-backed wellness insights. I'm Dr. Masayuki. Stay balanced, stay kind to your body, and I'll see you in the next video.